including our next speaker, who is going to be Pamela Brier, the President and Chief Executive Officer at Maimonides Medical Center, which, as some of you already know, is a 711-bed specialty care teaching hospital in Brooklyn. And she joined Maimonides in 1995 as the Executive Vice President and the Chief Operating Officer, and became President and CEO in 2003. And under her leadership, the hospital has been able to do amazing things, including opening Brooklyn's first and largest outpatient cancer and breast center, running a heart and vascular center with nationally ranked outcomes on par with the best hospitals in the country. And they also operate the largest obstetrics program in the state, with delivering more than 8,500 babies a year. And they've also established many quality and safety programs involving employees around the hospital. All the speakers' bios are included in your program, and I'm not going to read her full bio, but want to give her more time on the floor, so I'd love to invite her to please come up. And I also want to acknowledge and thank one of our dear friends at the Interfaith Center, Fatima Shama, the former Commissioner of Immigrant Affairs here in New York City, who is also now at Maimonides and helped connect the dots. Thank you so much.
Do I have to use that? I guess I do.
You can take the mic off.
Whatever. So, separating. Good morning, everybody.
Good morning. Good morning.
So, I can't tell you how privileged I am to be here this morning. When Bob Wolf called me, it didn't take too long to coax me to come actually very far away, although I love being in this neighborhood. We are in Borough Park, so it's not exactly around the corner. And I want to talk a little bit, just to sort of set the stage, but I'm not going to talk about palliative care or end-of-life care, because I don't know enough, and you all could teach me a lot of things. But I want to talk more broadly about what it is that helps make people healthy, and from there, I'm sure we can easily move on to other kinds of situations. There's no question that running a hospital takes a village. Making people healthy definitely takes a couple of villages, and not everybody speaks the same language in those villages, but that's okay. We can make that work. So hospitals are places where people are born, in our case, many people, and where people die. But it is not a good place for people to be unless they are very, very sick or having a baby, and even then. But it's not a good place to be, really. And my motto as the CEO of this terrific hospital is that people should stay out of hospitals as much as they can and be cared for closer to their homes, with people who can love and care for them more than is usually possible in a big institution. Maimonides we are fortunate. We have great doctors and nurses and wonderful staff, and we are well recognized for our clinical care and our teaching, and we are connected to the Albert Einstein College of Medicine. But that really isn't saying enough. We are a very diverse place. Borough Park and Southwest Brooklyn is about the most diverse community I've ever been in my life. We have 80 different languages and dialects spoken in the hospital. That means that the nurse on the unit in the middle of the night on a Saturday night needs to be able to talk to her patient. Otherwise, how on earth are we going to help people get well? It's particularly challenging with patients who have psychiatric problems. Myself, I don't get how we can comfort and help and take care of people if we don't speak the language or understand the culture. So we all try to live by our core values here. And but to do that, by ourselves, each one of the 6,000 people who work at Maimonides, it's probably not possible. Certainly not possible for me to be able to do that. We can take care of people's illnesses and help to treat them, and that requires teamwork, certainly. But to do more than that, we do need a village, and that village really exists outside of the hospital. And you all are an essential, really an essential part of this village, and I wish I had 5 buses and could sprinkle pixie dust all over you and take you all with me to Maimonides, because there is so much there that you could do, and don't think I wouldn't try if I could. So, we want people to take good care of patients, right? Right. But the only way I know that we can ask the staff to take really good care of patients and their families is to take care of them. So the environment has to be good enough for staff to feel comfortable and supported in taking care of patients. We have very sick patients, and we are blessed and challenged to be in the center of an Orthodox and Hasidic community where people grow up knowing that when someone is sick, they show up. And since some of them have large families, it's a lot of people in the hospital. And that is a blessing for people who are sick and nurturing, but it is particularly challenging for the staff who have to care for the patients, you understand, and take care of the families who are all in the unit trying to take care of the patient. It's definitely a Maimonides thing. But we do all know that medical care alone is not enough. We need to try our hardest, it's challenging, to really take care of and touch people's souls. And that is not just the patients, of course, although many of them are here really not for such a long time. That goes for the families of the patients, young and old, and it really goes for the staff who need nurturing and support so they can turn around and give that extra nurturing and support to their patients. So, as I said, our mission relates to a whole swath of our world. The mission statement that we have speaks to our underlying Jewish cultural underpinnings, but I would say that we need to cope and care in the midst of speaking, as I said before, many different languages. But we try very hard to demonstrate tangibly our support. We have the Patient Bill of Rights in 10 different languages, because what good does it do to put it up in English only if you don't read English? We have finally, after much drama and looking around, put together a Muslim prayer room, not big enough for the growing number of Muslims who are coming to Maimonides, but it makes us happy to have that in addition to our Jewish prayer room and our non-denominational prayer room. We have comfortable menu options for our many Chinese staff. We have a fabulous volunteer doula program organized by a few Orthodox women and dedicated to serving every single woman who comes in to have a baby. And it is a beautiful thing, I must tell you, to see the sort of juxtaposition of cultures, nurturing, and medical care all go on in the same birthing room. Maimonides is a place where, I think hospitals in general, but certainly Maimonides, is a place where everybody wants to do a mitzvah. And it's not just the Jews who want to do mitzvahs. I talk to my staff who are Catholic, and they tell me how thrilled they are to take care of a local Monsignor who is ill and who in fact ultimately died at Maimonides. And everywhere you look, people want to take good care of patients. And that's not just doctors and nurses, right? That is housekeepers who mop the floors in the patient's room. That's nutritional workers who come in and serve the patient's room. The clerk at the desk. Anywhere you look, people want to do their best and feel connected to what they are doing if we allow them the wherewithal to do that. You know, you wouldn't be surprised, because I think you're all pretty savvy, that people who wear uniforms, who are environmental workers or the clerical staff or nurse aides, they may not look like they are the most senior people in the organization, but many of them are leaders in their churches, in their schools, community leaders, and they live an entirely different life, which they want to bring to bear on what they do in the hospital. And it's very compelling. So these are things that we come to do at Maimonides, and I want to give you an example of how some of these things sort of link together. And I want to just tell you a little story about that horrible day on the 11th of September 2001, when all of us found ourselves with nothing to do in the hospital because there were no patients. Maimonides is located very close to Staten Island, and many of our staff had loved ones and family members who were either taken care of or were at the World Trade Center. And the staff was bereft, anxious, worried, and there was nothing to do to keep us all busy. And as I was walking around the emergency room, I don't know, around 9 or 10 o'clock at night, it occurred to me that we were trying to we had a hotline we set up in Urdu. We had food, we had cots, we were ready to go. And people looked so troubled. And I realized that we had failed to really look out for people's souls and hearts, because all of us were heartbroken. And so I came to work the next day, and I chatted up our chief rabbi, a Hasidic rabbi, and said, we have to make time for prayer and reflection. And he said, oh good, I'll get the other rabbis. I said, you can do that, but we must have the neighborhood clergy here. And we were blessed because we had some wonderful imams who also came in to help us. And so we had what we call non-denominational reflection services in our auditorium. And the first day after 9/11, we must have had about 10 during the day and night. And the place was packed. And the clergy from these different organizations spoke. And then people started to speak. And as the days went on, increasing numbers of Muslim patients came to these prayer and reflection meetings. One woman got up and said that she had not been respected by the person she works for. And there was just an instant gathering of people physically at her side to support her, because she wasn't allowed to go home and look out for her children in the way she thought she should. We got reports about young children, Muslim, Pakistani, a whole host of different children who were being harassed on the streets in this neighborhood. And we brought them in, and the way we feel at Maimonides, this hospital has got to be a place where people can sit side by side and respect each other no matter what is going on in the community. And it is very joyous to walk into a pediatric clinic, say, and see two women sitting side by side with their heads covered. One a Hasidic Jew and one a Muslim woman. And it's very gratifying to us, and there's plenty more like that. So I don't want to go on, but I want to make a point that actually echoes what you said. And it relates to the fact that hospital care is not the be and end all of the people's health. Now, I have known this for a long time, and I know you all conduct your work because you know it, because you know that too, and on that basis. When I was very young, just out of college, I heard a wonderful, wonderful doctor speak. This was the 60s, and he talked about how he wrote prescriptions for his patients for eggs and milk because he thought they needed that every bit as much as they needed medical care. And it stayed with me. And I think all of us in this room feel, maybe not about eggs and milk per se, but about the spiritual and the non-medical care and nurturing that it takes to get people through trying times, right? Whether they're having a baby or whether they are in the process of dying. So, fortitude, that's our motto here. Fortitude and a sense of humor. Those would be the things we must have to cope in this hospital. Recently, in the last couple of years, we have had the wonderful opportunity to work with what is now about 200, over 200, community-based organizations. Not medical care clinics necessarily, but social service organizations, wraparound organizations, organizations that help people with AIDS and HIV and drug addiction and homelessness and job training, the discharge program at Rikers, because we all know that there are more people who are mentally ill in prisons than there are in medical treatment, which is a terrible thing. And we are working with all of these groups because they have something to offer our patients. We are not the great, big, clinically terrific hospital, and they're just little community groups. Far from it. They know so much more than we do about what goes on with people when they're not in the hospital. And we know that we need all of these groups to create a village, if you will, for people who are ill, so that they will not have to be in the hospital all the time, so that they can be with family and friends and groups that can nurture and support them. And to me, that is really what all of you in this room reflect. And that is why it is such a privilege to be here today, and why I say that I would like to get you all back to Brooklyn to help us do this work. We certainly cannot do it alone, that is for sure. I'm not sure that all my CEO friends would agree that hospital-based medical care is not the be and end all of people's health. But as time goes on, they will. This is the way the federal government is moving. And I think that all of you in this room have a lot to teach us about what this all means. And I know that you have an enormous, important, essential set of tools and skills and fundamental values to bring to this very complicated issue of how we take care of patients through birth to death. You can teach us a lot about that as well. I would love to stay here today. I would love to stay here all today. I know I would learn a lot. I'm leaving Fatima and my colleague Sheila Nam, who will be speaking later here, to fill me in. But I do want to thank you all for coming and for being such respectful listeners, and tell you Godspeed. Thank you.